CataractCoach.com, here to talk about patient education with Dr. Shannon Wong. Shannon, you are very well known for making incredibly good patient education videos on YouTube. I've watched all of them. And so my question to you is, how do you set realistic patient expectations, especially for IOL surgery with these diffractive type IOLs?
Always under promise, and disclose information in layers. So it starts from even our website. Whatever we put on our website, we have to be able to stand behind what we try and lay it out there in plain English. And then we coach up our staff. We educate our staff because they're the front line. They're the front line for patient education. When a patient calls our office, we want to be able to kind of give them answers in plain English, managing expectations. And then when they come into our office, our technicians, they layer it a third time. They tell them these are your options, and these are the pros and cons of each option. We use statements such as nothing is perfect. We can't guarantee that you're going to have perfect vision. We tell them you still might wear glasses some of the time if you're having lens replacement surgery because you're in your late 40s or older. All of our educational materials are, for the most part, even our consent videos are online. They're on YouTube. So
they can watch it again later to really learn from it. Yeah.
And a lot of times we'll send them an email before their appointment that says, watch this, so you'll know more what to expect. And then when they come into our office, meet with our staff, even our displays that we have in each exam room, it goes over everything very simplistically, giving each individual pros and cons of their choices. Because we tell them there's no choice that's perfect. Even for LASIK patients, they'll commonly ask, hey, will I never need anything done? I'll say, no, LASIK makes you see normal for your age. You'll still keep aging.
One day you'll become old and need reading glasses for sure. I have a question for you. Do you give patients like multiple options to choose from, or do you help kind of steer the patient in one direction that you think, based on their eye measurements or their needs for their vision, their desires would be better? How do you guide them to make an appropriate choice?
So if we're talking about lens replacement or cataract surgery, that population, our staff does a great job. So before I even meet the patient, our staff has usually identified how the patient sees. They measure their near and far vision with and without glasses. They've done a lot of diagnostic testing. They actually know the diagnosis before I walk in the room, and they'll have educated the patient and help the patient go toward one direction or another. So when I get into the room, I'm really just layering on what the staff has already done for me. They've laid the foundation. And then I'll ask the patient just very few questions, actually. We used to have that Dell questionnaire.
Sure.
We don't use it anymore. We just ask them a few questions because we know, hey, if they're of the mindset that they want the best, they want the least reliance on glasses, in our practice, there's really two main options. And it's either a trifocal lens or an extended depth of focus lens. And we tell them, hey, the trifocal is going to give you the least reliance on glasses, but you'll see a halo around lights at night. If you don't want a halo, we have an extended depth of focus lens. You'll see great at night and during the day, far and mid, but you're going to need reading glasses. You can't have it all. So the lenses pretty much perform like that. And
sure,
so
that's a good way of putting it.
Yeah.
It's an easy way of putting it there. Yeah, another example that I like is I tell patients that, no man-made body part, whether it's a lens implant, a heart valve, or hip replacement, is as good as being 25 and healthy. But since youth is wasted on young people, or none of us can be 25 years old again, these man-made body parts can be significantly better than what you've got, but still not quite perfect.
Right. So I will tell them something along the lines of that. I can't make you 21, but for a 50-year-old, I'll tell them I can make you see pretty much like a normal-sighted 40-year-old. If you're 30, that has no value.
Sure.
But if you're 50 and somebody says we can make you 40, that has tremendous value.
Oh, for sure.
Yeah.
For sure. In the practice here, the patient experience, I think, has really been optimized here from the way you arrange it ahead of time, where they're called on the phone. I was overhearing some of the conversations, super professional. The way you educate them with videos or emails ahead of time. Tell me about the patient experience and how important is that? Obviously, you deliver A+ surgical skill and surgical results, but what about the experience?
It's with the people we hire.
The team, the A-team.
The team. So you can't do it alone. If somebody calls our office, the most important person is the person who's answering the phone. So we want them to be knowledgeable. We have all our staff shadow us in surgery so they understand the patient experience. And our technicians, the longer they stay with us, the more proficient and skilled they become at patient education.
Sure.
And so if we're doing thousands and thousands of these procedures a year, if I had to go through these conversations with each patient by myself, thousands and thousands of times a year, it's
a lot
exhausting.
of talking.
Yeah, so I'm grateful for our staff. They help us out a lot. And even for like a lot of these conversations are fairly, they're similar from patient to patient, and that's why we make a video, because if most of our patients have a very similar experience, have similar questions, we want to be able to just shoot them a video that they can watch at home.
And there's a consistency there too.
Right.
I think the videos are also brilliant in that the patient can, sometimes, it's like watching a movie. You got to watch it a couple of times to really pick up the details.
Right.
To really understand the nuances there.
And certain key things you can highlight in a video, so you can show pictures, or you can put a message in bold print. So there's ways to use video to emphasize things that people really should know.
Oh, fantastic. I look forward to watching more of your videos, but certainly with patient education. But also, we just shot a big interview. We talked for 2 hours. It's fantastic. You'll learn a lot about me. You'll learn a lot about Dr. Wong. And that link's going to be here. So check that out for our full 2-hour video. And I think you'll really appreciate it. Thanks for watching.